the first thing that I will talk about is what is the definition of disability. All right. So does that mean like if anyone say I have a disability, we recognize them as a person with disability? Well, here in Canada, the definition goes like this. It's a physical or mental impairment that limits one or more of your daily living activities. So these activities can be walking, thinking, understanding, seeing, speaking, and hearing. So these are the activities that we do every day, and if it's somehow impacted in any ways, that's the definition of a disability. Just for numbers, the statistics here. Now, I have to tell you, this statistics is from 2017. That's 6 years ago. Do we have more recent data? Well, I looked up on StatsCan. It says new data coming out this year. So it's taking them 6 years to find out more about disability. Maybe that's not on their priority. But anyways, 2023 is the year that we will have new data for statistics. All these statistics that you're looking at, they are from 6 years ago. Keep that in mind. So 6.2 million Canadians reported to have at least one disability. That is roughly about 22% of the entire population. Someone who said 25%, give yourself a pat on the back. We're not at 50% just yet, but
Does
22.
Mean that we got 10 people, then 2 might be?
Yeah,
That's correct.
Wow,
That's right.
that's a lot.
10 people, 2.2 will
Because
have
linked
that.
with the age, when you're older, you cannot walk, you cannot see properly, you
Absolutely.
cannot function.
Okay, wow. Okay,
And the
that's a
top
lot.
Yeah.
4 most common disability types back then, this is again from 2017, pain, flexibility, mobility, and mental health. Top 4. These are the top 4.
And Ian, if I may add,
Yes, go ahead.
nowadays, due to the COVID, remember 2019,
Yeah.
3 years, there are more mentally related disabilities now.
Absolutely.
And also some people are not reporting it, so they are not counted there.
Mental health related disability. It has something to do with people not being able to interact with in the social
Because
aspect,
of
right?
COVID. Oh.
Back then we were really stuck inside,
We're
right?
stuck
Remember
inside.
those days? You know, we can't go out to, you know, do a lot of things because of social distancing. A lot of people chose not to, and people slowly develop mental health issues. We'll talk about more about
yeah.
that. Okay. So in terms of percentage breakdown, we have 15% reported to have pain-related disability, and 10% flexibility, another 10% for mobility, 7% mental health and dexterity, hearing and seeing, they're all at 5%. So again, 2017. When I get new stats, you'll see these numbers change. These numbers will definitely change drastically. Okay, I'm going to talk about the map and then I'll throw it over to June to talk about more of these definitions. Percentage of Canadians with at least one disability, it's very interesting. We have 24% women reported to have disability and 20% of men. By age group, from 15 to 24, we have a relatively low percentage, 13%. From 25 to 64, that's a huge range here, 20%. And once you get to age 65 and up, you get a huge jump, 38%, right? And as Susanna mentioned before, this is directly related to aging, right? As the person is experiencing aging, well, the rate of disability will also go up. And any ideas on why women will have a higher percentage? I try to understand that.
Is it because they live longer?
They live longer. I like
I'm
it.
not quite
That's
sure.
right.
I'm not quite sure. Okay.
That's my first
Sorry,
thought.
guys.
That's my first thought, because in general, women live longer, and as a result, they will report to have a higher percentage. It makes sense. Men, on the other hand, they don't live as long, so you have 20%. Okay, so I'll have June to talk about the invisible and the visible disabilities.
Okay, thank you, Ian. So now we go on the part where we identify disabilities. We have visible disabilities. Those are the people you see by looking, you immediately recognize. So those are the people that has mobility aid. They might be in a walker, so that is mobility. Some people will have crutches, one or two. Some people will have the manual chair, like I do, and some have a power chair, like the huge bulky ones. People in a wheelchair, manual wheelchair, they have upper mobility. The power chair one needs the power, electric one. So we also have different kinds. Some people might ask, why I park in accessible parking? I can clearly see that there's nothing wrong with you. The person can walk, the person can stand on his own. So those are invisible one. One invisible is maybe they have internal problem, like they have a heart failure. If they walk like 20 meters, they'll be catching their breath. You can basically see those things. So when you are volunteering, your first time to meet a person, you might not see anything wrong physically, but as you go along, as you know them better, you will realize that they have invisible disability. It could be mental. You'll start noticing that when they start talking. Maybe your communication expectation will not be met. You ask them a question, they go some other places. Some would not even look at you in the eye like you're doing now. So I'm sure you're aware that there is ASD, autism spectrum. So those are the invisible ones. And vision loss is quite obvious if they're wearing the black huge glasses. If they take it off, it might not be too obvious, because some blind people will just look at, and you think they're looking at you, but I'm not looking at Amy right now, I'm past Amy. So you don't know that I'm blind unless I start folding out my cane,
Yeah.
right? And part of the mental is the cognitive or the learning disability.
Thank you.
I got a question.
Go ahead.
Once they walk into the RCD, Richmond Center for Disability, should we ask them, say, what kind of disabilities you have? No, we
Okay.
shouldn't, right?
We'll cover that in a bit.
Yes,
Because
we'll reach that part.
we'll get to the part where
Okay, I'm sorry.
we
That-
talk
that's
about.
a good question.
Yes, it
That's
is
a
a good
good one.
question.
That's a good
Because often we don't interact with people with disability every day, right? That's the main problem. So when we interact with them, very often you don't know what to do. It's very similar to, how young boys, they don't know how to talk with young ladies. They don't know what to say. The words come out wrong and stuff like that. It's a similar idea. It's just because we're not familiar on how to handle certain conversation, then we may say the wrong thing. But here we'll talk about
Okay, yeah.
more of that.
That is where the sensitivity will come in.
Okay, good.
How you're able to talk to them, questions that will give away, but it's up to that person to disclose their disability. Okay. So let's go to this, some terms that we use, because as part of the sensitivity, there are languages or words that no longer used in our society. The society has developed quite a while now. So let's expand more on these definitions. Impairment, from the word itself, im is a negative word. So any loss of a normal function, whether it's be psychologically, physiological, or maybe anatomical, the part of the body. the word even disability has a negative meaning, connotation. The word this means not. So you're not able, you are disable. So we try to move away from that kind of words. And then you have the limitation of performing our daily functions. Things that might be easy for most of you guys, but very challenging to that person. As simple as drinking water will be a challenge for somebody who has physiological disorder. And then the barrier for people in a wheelchair, it's a good practice for you to experience. Try and sit in a wheelchair and try to move it left and right. You might find it funny at first because you get off balance. And even a tiny pebble on the flat surface will be a struggle for someone in a wheelchair. So those are barriers. What are barriers? Steps. If you invite me to your place and you have steps in your house, I'll probably stay outside in the porch. I won't be able to join you inside the house.
Yeah.
So that those barriers are sometimes you overlook them because you don't experience them every day. And participation restrictions, they are not able to participate in the daily functions.
So these terminologies are very important. So when we talk about impairment, remember it's a medical condition. When we talk about disability, it's a limitation of some sort. And when we talk about barriers, it's a restriction, it's a participation restriction. Okay, now let's test you out a little bit. So I'll ask you these 3 questions. I'll give you a scenario, and you tell me what is the impairment, what is the disability, and what is the barrier. So you can raise your hand, or I will start picking people. All right, so here we go. First scenario here, a person had spinal cord injury due to a car accident and can no longer walk. He is using a wheelchair. What is the impairment? Yep, Mercy?
The spinal cord injury.
Very good. It's like you've done this before.
Did
And
you?
the next one, what is the disability involved here?
Ian, if I can further,
Oh, sure, go ahead.
because maybe some people don't know the spinal cord injury. It's that long bone from the top of your skull all the way to your tailbone. It's quite a long bone, and it's not one piece. It has
Multiple.
different pieces. Okay?
The next part is, what is the disability involved here?
Can no longer walk.
Can no longer walk. I want someone other than Mercy.
I think she has a copy of our.
And the last part here is, what is the barrier for this person? Wheelchair is actually the tool that
Tool.
allow access.
Yep,
So it's actually not the barrier. What is the barrier?
I mentioned it just now.
Restriction steps.
Steps.
There you go. Stairs,
Okay.
steps.
So it's not just steps,
Oh.
because yes, there are places with no ramps, things put too high, no curb cuts. And of course, obviously, steps are the most obvious barrier to a person using wheelchairs. But it's not just that. There are other things. Mainly, if you go to a store of some sort where they have merchandise that's put up too high, people in wheelchair can't reach, right? We're creating a barrier. So that's something to keep in mind.
Yeah, just
question.
a question. Do you think attitudes can be a barrier sometimes?
Absolutely, and we have a big section
Okay, great.
on that part. Now, next scenario here, a person had a stroke and the part of the brain for speech is damaged, and he has slurring speech. First question, what is the impairment? Very good. I think everybody's got that. It's a stroke. That's the medical condition. What is the disability? Slurring, right? The slurring of speech, which is can't talk clearly. But what is the last part here? Barrier. What is the barrier?
Communication.
Yep. Well done.
I hear that. Communication. Fantastic. Right? That's the barrier in this scenario. For a person who's very close to this person, very used to this slurring speech, they may understand each other perfectly. But when they come to a place like RCD, where they want to engage in some activities, all of a sudden communication is an issue, right? So it's very tricky, but we have to try our best, put in the time and be patient, and to help and support this person. And sometimes it's a matter of just sitting through it and finding a way for you to communicate effectively. That's very often the case. Do we have any questions with this slide? Very important terms: impairment, disability, and barrier. Pat, you were asking about this. The attitude, can that be a barrier? Absolutely. And June, perhaps you can talk about that.
Sure. So, people with disabilities has been labeled, name calling when you were younger. What I'm saying is you've been called different name, and some names are no longer acceptable. You are seen as different, but different not in a good way. There is always that negative understanding. People who's not been in that situation will definitely be quoted in a negative way. And we have the miscommunication. People sometimes they cannot speak clearly, and when the conversation goes, you are being nice, you try to help. Instead of waiting for them to finish the sentences, you're putting words in their mouth, right? So they want to say something, and then you insinuate, you tell them the words because you've been trying to help them. You mean it well, but it's actually affecting the other person. Okay? And lack of knowledge. If they see people with disabilities, they already think that he's not that smart. Right? It's a common misconception. Because probably of the social media, the TV, we hear that they're not that smart. But I don't know if you're aware that the famous guy in a wheelchair, well, he passed away. He's actually quite a genius. Stephen Hawking. Yeah.
Quantum physicist. Right?
He's a quantum physicist. He predicted what will be the result of our society. So he's a very smart guy. He didn't start it. He wasn't born with it. It was developed. There's a famous movie you can watch about his life, how it developed, how it affected him, and how the people surrounding him have reacted to that. And they think that the people with disabilities are not that fast enough to adjust to the changes. That every day there's new invention, that we are slow. If you have disability, common thinking is, oh, you're slow. Okay? And just be careful of the word special, because it's been used so much that the value or the meaning is no longer there. When you say special, sometimes people get jealous. What's so special about you? Am I not special? Are you not special? It's special in a different way. Okay? When you don't have that understanding, then you will not be able to understand what that person is going through. They don't need special treatment. They just want to be treated just like you and me.
This last point is very interesting, because very often when you go to movie theaters, there are special spots for people with disability in wheelchairs. And when you go to the mall, there are parking spots also designated for people with disability, and you need certain card or parking placard to park there. So a lot of people may think, hey, how come they get to park at all these places where other people will need to walk and so on? So that's why for some people they form this kind of attitude. Do you have any questions from this particular slide, the attitude?
I do not understand that, that not the content, but the picture.
Attitude changes everything? Well, absolutely. Well, if you have a negative attitude towards something, you tend not to listen to what they're saying. So if you somehow have a negative attitude towards people with disability,
Oh,
you now not only not give them a chance in society, but you're kind of ignoring them, putting them aside in the society. And that was actually part of our history. Our government had a long history of putting things that they don't want to be in this society, put it away. Institution was one of those. Institution is where they put the people with disability together, far, far away from city, lock them away. And do we have, we also have residential schools where that's a different topic. But you get the idea, you get the drift, right? How these attitudes can form eventually policies that can really hurt groups like us, like them.
And the attitude changes because when you have a lack of knowledge of something you don't understand, there's always fear. And that's a human nature.
And you'll probably get to it later, but universal design and the idea of, like, he was the example of curb cuts,
Yep.
benefiting people with disabilities, but also mothers with strollers and people who have other
Absolutely, yes.
challenges. So,
Universal design.
Yeah.
We actually have a slide at the very end to talk about that, but yeah, that's good. Let's progress through this part first. When we talk about simple sensitivity, so this is a general way that we can help people with or without disability. So whenever you're not sure on what to do with this person in front of you who may have a disability, you can always ask the easiest way. This slide I designed for service providers, right? So you can always ask, how may I help you? This is a very neutral way of asking, like, do you need any help? Is there something I can do for you? Very neutral. If you can't understand for some reason, you can ask politely again. Or you can, like, just at the beginning, Josephine had to repeat herself like 5 times because I couldn't understand her through the mask and everything. I couldn't understand the word that she was saying. So I just said, oh, can you repeat that again? Sorry, I still don't understand. Can you rephrase that? So these are different ways of you to communicate. It's helping communication in certain ways because you're not ignoring this person. You're actually spending more time to understand what she or he needs. This last point here is very important because a lot of people may want to jump and start, doing stuff for the others. Well, we always recommend ask before you offer to help. Don't just jump in. Your customers know if they need help or not, and they will ask you for help if needed, right? Don't just jump in.
Okay, Ian, I'll expand a little bit on that part. You guys I'm sure you're all aware of personal space, right? So when we mean a personal space, a person who is in a chair will have his chair as part of his space. So if somebody is in a wheelchair and you're talking to someone and you're leaning on his wheelchair, so is that invading his personal space? It is. When you try to help, just immediately without asking, just grab his chair and you try to, your intentions are good. But the person who's in that position knows better. If he falls on the ground, don't just pick him up and just put him back on the chair, because chances are you might injure them. That is why I have to ask permission to help first, because they will guide you. Okay, this is the safest way. I will give you the clue. I will give you the prompt. I will tell you how you are the best way to assist. So if you encounter that part as a volunteer, just ask, how can I help? And most people will gladly tell you.
Absolutely.
Okay? Thank you.
Thank you. Now, in the beginning of this class, I think it was Amy who asked, hey, are we supposed to ask what kind of disability they have when they come into the center? We are RCD, right? We can do that? Okay, well, point one here. You don't need to refer to someone's disability unless it's relevant.
What do you mean?
What I mean is, if they come in, let's say they are just asking for information about classes, okay? Do I need to know this person's disability? No, they're just seeking for information. But what if this person wants to sign up for a class where he or she is here to learn public speaking skills? Now it's important for me to know, first of all, if there's a speech impediment involved. Is there a cognitive disability involved? Is there a learning disability involved? Because these are very important on the success of this person taking this class. After all, we do want to have this person learn a skill. So in this example here, or the very first point here is, do not refer to a person's disability unless it's relevant. If possible, let them mention about their disability first. Sometimes they're very open in telling you what happened to them, and I have a lot of taxi drivers, they're driving and all of a sudden the customers with a disability is talking about their story. And some are very open to the idea of listening to it, and some may not be so. It's different from person to person. Some of them don't even want you to mention about the disability. But if they get a chance to talk about it, sure, let them talk about it first. The next point here is avoid negative description of this person's disability. So over the years, we have very negative terminologies developed. We're slowly trying to get those words away, and we use what we call the people first language. All right. So just for an example, if someone who cannot walk, cripple was a term that we use a lot, right? But now we no longer use that. What we use is this is a person with mobility issues, right? It's a very neutral way of describing this person's condition.
If you remember, even in the Holy Book, some of you have read, the word crippled is mentioned, right? But because of the changing society, it's a kind of offensive now to refer someone with that name.
Mm-hmm. Yeah,
So we use people's first language.
yeah.
And we'll talk about people first language in a bit. Now we go into the specifics of each disability, starting with people with mobility disabilities. And June, go ahead.
Okay, I think we have touched this topic a little bit. Speak normally. When you don't know the disability of that person, don't talk slow because it's funny. You just met the guy and you're asking, how are you today? If I'm that person, hey, why are you talking to me like that? You can speak normally. You don't have to talk so slow. Okay? Normal. Because they can sense, we can sense if we are being treated in a different way. Okay? As again, your intentions is actually good. Now, again, ask before giving assistance. And we already talked the third one. Do not hang, like, hey, how's things? And then half of your body is leaning on his wheelchair. That's a kind of rude. We all come from different backgrounds. Might be normal for you guys, but of course, it's different. The society is different. Okay? Take step to ensure if they think that this person with disability doesn't understand, are not able to communicate, so chances are they'll keep talking to that person standing
The
or sitting
companion,
next to
yeah.
the companion.
Yeah, yeah.
So-
It's better to ask permission first. Should I talk to your companion?
You can, yes, of course.
Absolutely.
Okay, don't assume that that person being attended to has some mental issue that they will not be able to hear, understand.
Next topic I want to talk about is people with vision impairment. Now, when we approach this group, we have to make our presence known. For them, they can't see, so very naturally we use our voice. Our voice is now the best mode of communication. They can't see your gesture. So unlike the other group, now we have to think of using our voice to be our best tool for communication. So here you can ask before providing assistance. And if there's a surface animal, so a lot of people ask this, like, can I just pet the surface animal? Try to stop yourself from petting these killed animals because they're actually on duty. When they have their harness on, they're actually on duty and assisting the person with disability. And for this group, we talk in normal tone. Again, not to their companion, and we use their names if possible. If you know this person's name, you use their names. You can say like, Mr. or Mrs. Wong, what can I do for you today? All right? You can direct them by simply describing how far you are from something. So when you're asked to guide, basically don't pull or steer or grab the dog's harness. What you need to do is describe to them, okay, we're gonna go straight and we're gonna make a left turn here. And in 3 steps, you're gonna be arriving to where you wanna go. It could be a washroom, be descriptive about where you're going. Because sometimes they can see a little bit, very blurry, but the detail of the vision is not there. So it's very hard for them to grasp what's in front of them. If you have enough description in your words, it helps a lot.
Yep. And I'll just add to Ian's point. You can say if you're sitting in front of them, you just mentioned, I'll be sitting in front of you. So they know that exactly where to direct their head. And they have a dog with them. The dog sometimes is wearing a uniform. And in the uniform it says, please do not pet me, I'm at work.
Oh.
You find it funny, right? But that's actually the dog is at work. These dogs, they are raised from the time they are born to be assisting a person. I don't know if you have seen, I've seen a dog opening the door.
Wow.
The dog will go up and push the automatic door
Uh-huh.
for a blind person.
Wow.
Even the elevator. They will not push the small one, but there are elevators now in the new building that is on the side. It says number 1, number 2, and the dog will push that using their nose. So if you see that, hold back your emotions. They look cute. Try not to pet them.
90% of us would go out and say, good doggo, that's a good dog. But they're working. Go ahead, Jim.
So now when we see them, people with challenges, do not assume right away that by looking they are not able to do. There is a limitation of what they can do, but don't jump to assumption, okay? Because you might end up in an awkward situation. And try to use simple, basic, descriptive words. Don't fancy yourself. Maybe you've studied some medicine. Do not use jargon. Use the simplest words to describe things so they'll understand what exactly do you mean. And then allow time for communication. Don't rush. Like somebody's talking slow, don't get it? I have time limit, so can you talk faster? So give time. Because some people with disabilities, depending on their disabilities, it takes time for them to process. Even a simple "How are you today?" They are not trying to be snobbish, but it takes time for them to process the thoughts. Some people will even repeat what you're saying. Don't be impatient. They are repeating because they don't understand the words coming out from your mouth. When you say "How are you?" they have to repeat it. How are you? That's the only way for them to process the whole thought. Okay? Do not patronize them. It's a quite it's insulting at sometimes. And then from their movement, you can have idea of what they're trying to do. If someone is trying to grab this, you have idea that he's going for the coffee, right? So that gives you a visual clue. Small things like that, pay attention. So when you're conversing with them, slowly you will know the person as you go along. The more time you spend with them, of course, the more time you will understand their needs. Okay? Patience is the key. Okay?
Just so you know, the word developmental disability has the same, almost describes the same thing as a cognitive disability. So if you see the developmental, cognitive, they're roughly the same thing.
And what would be the difference when you have an acquired brain injury as opposed to a developmental disability?
Now, the difference in terms of the experience, I'd say, will be a huge thing. Because cognitive disability, very often, or also known as developmental disability, it's there at birth. So very often when they learn things, they just don't learn as fast. But if it's an acquired disability, then their experience from before is still there.
Yeah,
And-
it will guide them.
And that will help them a lot in basically preparing for this type of scenario, the situation with a disability.
Right, and it would depend on the kind of brain injury, what area of the brain was damaged. For example, language issues
Yeah.
could develop from that.
Yep, absolutely. And the developmental disability can have the same impact. All very similar, very similar. Yep.
Yeah.
I got a question.
Sure. Yeah.
I got a, what's that called? Can I say it's a client?
Okay, sure.
But I work with her, and then her speech is really slow. Can I train her to speak a little bit faster? Or we just have to accept the way she is? And I got another one, which is a gentleman, but he always want to repeat the word 3 times. I
Okay.
say, I heard it, I got it. Should I say that kind of things, or she was born like that? It,
Right. So
he say it 3 times because he think I did not understand it, or I did not hear it, or should I, in between I say, I got it, I knew, I heard it. Oh, what should I do?
So rather than changing a behavior that's been there for a long time, at that point it's probably
Will it
very
upset
hard
them,
to.
or-
It may upset them, right? Rather than changing a person's behavior, I think it's important for us as service provider to think about what is the best way for us to provide support to them. The bottom line is, if they want to repeat the word 3 times, good. I now understand you. This is very important because you repeat it 3 times, right? And if this person speaks very slowly, and that's fine, because it actually allows clear communication. I will tell you right now, it's the fast talkers that will get me in trouble because I miss a word or 2. The slow talkers, like in terms of speech, are the ones that I can really focus on and pick up what they really want. So nice and slow, keep that pace going. And I think as a service provider, that's basically all we can do. We're not trying to change anybody's behavior. It's not a disease. They can't get they cannot recover. This is now part of them, and respect that, and provide the best services you can.
Ian, can I
What do you
tackle?
mean by support? That's, I learned it, on volunteer so many times. What do you mean by support?
To help
like
people.
a baby, you hold
To help
it
people.
and-
That's one kind of support, but to help people, to assist people in what
To
they need.
try to make their life better.
Better,
right.
Yeah.
easier.
Yeah.
But don't change them, right?
No.
Exactly.
Not like,
Yeah,
No.
don't
this
change
is
them.
a-
No.
Not a training.
You can
training.
try, but I don't think you'll be able to change them.
Yeah. Can I?
Yes,
Yeah.
Susanna.
Okay, yeah, because I noticed some of them, not because they don't know, they can't control it. Just like when I talk to a person, when a serious thing, and he keeps smiling, not because he doesn't understand, but that's his tick. He born with it, he can't control it. Sometimes even though he's scared, he smile
Yeah.
because that's something just in him. He cannot control it, and you definitely cannot change him. Yeah.
That's
That's
not
true.
kind
That's
of
true.
support
Absolutely.
you requested, the one to
No,
we do that.
That
Okay,
only
got it.
make him feel worse,
Worse, that's
because you try to change him, there's something he cannot control.
Exactly.
Just imagine this. They're
Got it.
coming here
All right, yep.
to
Now I learn it.
learn skills to make their speech better. Now you all of a sudden you're changing their behavior because they're doing something differently than your expectation. Yeah, I wouldn't recommend it. I think we have a question at the back.
Yeah,
Yes.
go ahead.
So I'm just wondering, I just met a young man in our table tennis club here.
Okay. Yeah.
And then I think he had some issues like
Mhm.
that. And I'm saying that as the development disability, I'm thinking we all can help because that is our community support for helping to get a better. It's not changing everything.
That's
But I
right.
think we can do something like a comfort. I still wondering last time, his daddy come late.
Right.
And then he's waiting outside and then
Okay.
walking around and then I say you just take easy. I just talk like a baby, like a kid.
Right.
The daddy will come, you just sit down and wait.
Oh, okay,
Patient.
okay.
I think I talk like a
Right,
talking
so-
like a kid. I don't he is the big boy
Right.
of us.
Exactly.
I think okay, sometimes I say it might be a little too much.
Right, so you want to talk age appropriate. And I think in a slide or two we will talk about that. Like even though their behavior, because they have lower IQ, they have a learning disability and whatnot, we tend to lower our expectation age-wise. So
You
this
cannot
person
talk
is in
to
the
them when you
20s.
talk.
Exactly, this person is in his 20s. Now we're talking as if this is a person who's 10 years old. So it's not appropriate. Right? If this person appears to be 20 years old, talk as if he is 20 years old. You don't need to adjust your method of communication. Just talk normally. Only change it when it's not working out. Like this person doesn't understand you, or whatever you're trying to do is not getting through to him, then you need to change strategy.
I just try to comfort him. I say don't worry, that is the
Yeah.
thing.
But thank you for helping. That you're coming, you are taking the right approach. I think just give it a little bit more time. Maybe you can even get to know this person. Yeah. Thank you. Thank you.
Ian, go ahead. Go
Yeah,
ahead.
go ahead.
I was just wondering if it's appropriate sometimes to ask a parent or caregiver for tips on how best to interact with a person.
Oh,
Yeah.
And
absolutely.
different
Yeah.
It
sort
is.
of ways and sometimes clues around how they're doing on that particular day.
Right.
Because
Yep.
some days are worse than others, or
Yep.
better. Right?
Absolutely. So it's always a good idea to talk to the support workers or their parents or guardians, just to check out. For our summer camp, for example, back a couple of years ago, the parents or the guardians will actually come to you and say, "Oh, he's having a bad day." Right, so that means that it's a heads up. It's a big heads up. So he may be throwing temper tantrums. I think it's next week. I think
Yeah,
Vincent
we'll
will talk about
the
special needs with children, right? So how to support that. Vincent's very good. He's been with our summer camp for many years. And then it's good, like that's extra information that they volunteer to give it to us. Fantastic. But if you want to learn more about it, this participant, you can go ahead and ask the support worker. It's actually a very, very effective way.
Yeah, they have years of experience in dealing with them. They can see as tiny changes in attitude. They can sense it. So that's a good tip.
And
And,
I think
yeah.
it's always ideal to ask the person themselves first.
Yes.
But if there's that lack of insight or inability to communicate on things like that, it's okay to
Oh, yeah.
ask that first.
Yep.
Yeah, absolutely.
And Ian, I'll just touch on a little bit on Amy's question. You guys have probably heard the obsessive compulsive. I shouldn't be saying disorder, but that's the medical term.
OCD,
Yeah.
yeah.
OCD, right? If a person has OCD and put this thing like that in that position, believe me, you move it like this, you upset him. Even normal people, maybe some of you, you remember, yeah, how you fix your towel in the bathroom? You want all the towels to be nice and neat? That's a sign of an OCD. There's nothing wrong with that. It's just probably the way you were brought up, the way you were growing up. And you know, when you have OCD, I'll give you, how many of you have watched Big Bang Theory?
Yep.
Yeah,
Sheldon?
yeah,
Sheldon? Sheldon?
yeah.
Yeah, that's right.
Sheldon always does that. There is another movie, The Equalizer, also has that. Denzel Washington is the star of that. If you have not watched it, watch it. That person acts everything pretty much normally. But he has to close the door 3 times before he beats up the bad guy. And he will arrange things to intimidate you. So people who have OCD, they don't know. They cannot control themselves. They cannot even explain, why am I acting like that? Okay? So just be mindful of that. Some people want it this way. Don't ever change it. They will know.
The other thing is routine is very powerful, I think. too.
Routine is one of them.
And to disrupt a person's routine when they're
Exactly.
pushing in a certain way can be very upsetting.
Yes, and people, person with disabilities, they want to do everything according to their plan. Small changes would ruin their day.
Next week, I think Vincent will talk about how important it is to have a routine that's visible to the campers, because mainly it's from the children's perspective. You stick all these routines on the board. The first time they come in, they know what to expect. Less chance of them to throw a temper tantrum, right? So that's very important to have a routine set up visibly. Okay, I'm just looking at time because I have some scenarios to go through with you. So I'll quickly go through this part, and then we'll go through this video discussions. Okay, for people with speech impediment, do not finish the sentence for them. Allow them to finish. Even though it may take a long time, go ahead and just let them finish. Don't pretend to understand. That's very important. Ask politely for them to repeat or rephrase what they're trying to say. If appropriate, you can ask simple yes/no questions. And do not assume the person has other disability. Right? Very often when we interact with a person with speech impediment, we may also think this person has a learning disability or a developmental disability. That may not be the case. And once again, be very patient with this group. So I'll just go through these and then we can get to the scenarios, because I want to leave about 20 minutes or so for that. People with learning disability, if possible, put things in writing for them. All right, have a checklist for them. Hands-on training is a really, really big thing. If you can break down these tasks in line items, and there's check boxes, that's really helpful for a person with learning disability. Take time to understand the person's special needs. And remember, learning disability person with learning disability has normal intelligence. Part of the brain is restricting them from learning in certain ways. So for example, we have these big umbrella, big words here. Dyscalculia is how the brain restricts this person from learning mathematics. Dysgraphia, visual. Dyslexia, words. Right? So these are the things that maybe something within the brain that just restrict them from learning something effectively. That's unfortunate because this person may have normal intelligence. But nonetheless, when you try to teach a person English and this person has dyslexia, all these letters will be reversed, right? And no matter how hard you try, they will have a very tough time to write these English words correctly. And we're gonna talk about the people first language at this point. And we have a list here. So remember we developed a whole bunch of words, we no longer use. Well, these ones are the ones that we don't want to use anymore. Retard or retarded, or the blind, the disabled, handicapped, all these. Now we have a different way to address people with disability, such as a person with intellectual disability, a person who is blind, or with vision loss. In general, you can say a person with disability, but not the disabled, right? If you say the disabled, is very disrespectful. A person who is deaf or has hearing impairment is the correct way, rather than saying deaf and dumb. Even though this is from the Bible, right? I believe this was a phrase, and a lot of terminologies in the medical field, they are still related to these terminologies. Mental retardation, for example, is still being used. But here, as service provider, we don't use these words. And a person who is hard of hearing and so on. And more. Confined or restricted to a wheelchair? No, we say a person who uses a wheelchair. A person who has muscular dystrophy. A person with a physical disability. A person with Down syndrome. Or a person with mental health illness. Here at the bottom here, we have handicapped parking. A lot of people will still say handicapped parking, but we now call it accessible parking because that's a more appropriate term for it. Able-bodied or normal, a person without disability, it's appropriate as well. When you have a group of people with disability, all of a sudden you just want to point out, oh, this normal person here, that's a really awkward way to say that. But if you say, oh, the person without disability over here, that's more appropriate. I'm going to skip this because effective communication is something that you can research on your own. But I will talk about how to remove barriers. Acronym here is TALK, as in take the time. Ask and don't assume. Listen attentively. And K for know the person's needs and act upon them. So remember these acronyms. Reasonable accommodation is the last topic I will talk about on this PowerPoint. Reasonable accommodation is a legal obligation to accommodate a person with disability. It's part of the Canadian Human Rights Act. So you can't refuse service. This person comes into the restaurant, let's say in a wheelchair, but you say, oh, you're in a wheelchair, we can't help you. We cannot provide service to you. No, you can't do that. Right? When you open your doors, you are doing business. Here in Canada, the Human Rights Act dictates that you have to help each and every person coming into the restaurant or whatever store you're providing service for. All right? You can't refuse service based on the person's disability. That's a big no-no. But that also means you may have to make special arrangements or make the appropriate adjustments. These chairs your tables aren't designed for wheelchair, people in wheelchairs. Right now you have to change the tables and so on. So that's something that you always have to keep in mind. And there are rules like that, city bylaws and whatnot, to help with that. So that's something to keep in mind. And what we're trying to do is make sure that everybody can participate fully and equally. That's the bottom line. We just want everybody in the society to take part in whatever they want to take part in. In equality, that's when everybody's provided a box so that they can watch the ball game, right? But look at this. This guy can't watch. He cannot reach. But in justice or fairness, what we are trying to do here is to redistribute these boxes so that everybody can participate fairly by doing that. So that's like a brief visual for that. Equality is this quote that I like. Sometimes equality means treating people the same despite their differences. And sometimes it means treating them as equal by accommodating their difference. Okay, so that's the PowerPoint part. Do we have any questions regarding this PowerPoint?